When you're on hemodialysis, you'll often hear the term ultrafiltration or UF. A nurse might say, I'll UF 2 liters today. This simply means they plan to remove 2 liters of fluid from your body during your treatment. Let's dive in if you're curious about ultrafiltration and fluid gains and why it all matters. First, let's talk about dry weight, which is the normal weight without any extra fluid in the body. For people with kidney failure on dialysis, fluid tends to accumulate because their kidneys aren't effectively removing it. While some dialysis patients can still produce urine due to residual kidney function, everyone on dialysis must monitor their fluid intake carefully. Dialysis helps by removing this excess fluid. Here's a simple scenario. A patient's dry weight is 100 kilograms. The patient comes in for dialysis on a Monday at 105 kilograms. Our goal is for the patient to be at their dry weight, so we need to remove the excess fluid of 5 kilograms or 5 liters. The Centers for Medicare and Medicaid Services recommends limiting the ultrafiltration rate or UFR to 13 ml per hour per kilogram to reduce complications. The UFR measures how quickly fluid is removed during dialysis and is associated with mortality risk when it is too high. Let's calculate the UFR in our example. Let's say the prescribed dialysis duration is 4 hours. This UFR is within the CMS guideline, but other factors may adjust the plan. Number 1, starting blood pressure. The nurse may reduce the UF goal if a patient has low blood pressure before treatment. Number 2, dialysis side effects. Symptoms during dialysis like hypotension, cramping, blurry vision, headache, or chest pain may require lowering the UF mid-treatment. Number 3, physician orders. Doctors may prescribe a maximum UF not based on the CMS guideline but based on patient history. For example, lower UF is needed for patients prone to symptoms, even within the guidelines. Higher UF for patients with high fluid gains, possibly coupled with increased treatment frequency or longer sessions. This is done to prevent fluid overload. Unchecked fluid overload can lead to high blood pressure, cramping and hypotension, shortness of breath, edema, and chest pain. Studies show that overhydrated patients had a 62% excess risk for mortality compared to those with proper fluid management. How to manage and prevent fluid overload. Fluid restrictions. Fluid intake depends on weight, urine output, and health status. Your dietitian can provide specific guidelines. Reduce salt intake. Lower sodium intake to minimize thirst and fluid retention. Stay compliant with dialysis treatments. Avoid skipping or cutting sessions. Research shows that non-adherence to dialysis schedules significantly increases mortality and hospitalization risks. Understanding the impact of ultrafiltration and fluid overload is essential in hemodialysis. Managing fluids can help reduce complications and have a more effective treatment experience. If you found this helpful, check out our next video to learn more about dialysis options available.